let me ask this question again. Do you think that you have to stop eating sugar? Or does sugar really cause diabetes?
Yes, you have to stop it.
Okay.
You have to stop it totally.
Don't stop it. But why?
Don't stop it.
You need sugar to give you
food.
Energy.
No, this thing we already have enough sugar in the food we eat. So you can't be adding more sugar to it.
No, that's why I'm saying not stop it. So not quarter. Manage your
diet. Yes. Your biggest problem is not necessarily raw sugar.
And try say sugar. Now only for sugar.
Good. So that brings me to
1 point.
Thank you. That brings me to the point that I'm come to make. That what you are supposed to be worried about are foods that will always end up or break down into sugar. And so the class of food that you are supposed to be worried about is called
carbohydrates.
Good. 1 point. It's carbohydrates.
Yeah.
So if you are worried about diabetes,
too much protein.
Yes, too much protein. Yes, but the end product of protein may not necessarily be sugar. What's the end product of protein?
Thailand.
COVID vaccine.
Amino acids.
So Doc, when you want to eat, how the food go dey like, the bowl go dey like. But if you be kenke, you chop like 3, you mash like 3 kenke, you chop plus pepper, then the 2.
After all I have said,
so minus 3. This one is no. I can't forgive you for this. I have to
that the food that you're supposed to be worried about most is what?
Carbohydrate.
And you are going to chop kenke.
3.
Oh, so if you go chop kenke 3, the man should be go satisfy like the way you go satisfy if you chop 1.
No, it's not about satisfaction.
It's about the
sugar level. You are at risk of having diabetes.
1.
No mind.
So you see, if you have a plate of food, normally this is what we recommend. About what portion is it? Is it half and half?
1.
Half. So
1.
This one.
Which one there?
That's 1/4. Yes.
Do you know quarter?
What's quarter? 1/4.
Quarter is 4. Where is the 4?
So if I bring this here,
since you haven't got there, it's 3. 1/10.
But this portion is still 1/4. So about 1/4 should be carbohydrate. Another 1/4 should be like the protein. And the rest should be just vegetables.
No.
So this is how your plate should always look like.
I understand.
We are about ending for today to know who is winning. The last question on my list is that what do you think are some of the complications of diabetes? Complications, what do you think complications mean? Complications mean that if you don't control your diabetes, what will happen?
Yes. When you get cut, it will be difficult to
heal.
3 points.
Yes.
No.
Are you going to say something?
No.
Suarez, yes.
You can collapse.
3 points.
Collapse.
Yes. I will explain. So, right.
Doc, your eyes,
wound.
your sight, you know go see well.
Yes, I mean, yes. That's also another point.
You know go see well.
Yes, it's difficult to see. Diabetic. It's called diabetic retinopathy. So, in fact, it's the common causes of blindness.
What about stroke?
Yes, diabetic is a major risk factor for stroke. But we'll have a quiz on stroke.
So you answer one, they know ask me the answer two.
So sudden collapse.
Yes.
Difficulty in wound healing. And blindness if you like.
So now you have to come back to me.
Yes.
Your kidney issue.
No,
because you put pressure on the kidney.
Yes.
So it can fail.
It is true. So
you just mentioned it. You mentioned it.
I didn't mention it. Oh, okay, maybe I think God I started because you already knew it.
I knew. That's why I was waiting.
You are giving the benefit of the doubt.
I'm using this thing to answer my question.
Yeah. So there's kidney failure. That is very important. So what else?
Oh, eating a lot. And then
high cost of living.
Yeah, but that's not a complication. How is it? Get away. So,
Because now
but
you eat one, now you eat 3.
But
Now you urinate 20 pesos, now you urinate 100.
so you see, because there is difficulty in wound healing, sometimes if you get a cut, you not even feel
You
it.
amputate your
So
leg.
it can end in amputation because you will not even feel that there is a wound. And then it's also very difficult for this cut to heal. So
We've spoken about the blindness, that's the retinopathies, nephropathies, difficulties in wound healing, what else?
kidney failure. I mean, diabetes is one of the conditions that can affect almost every part of your body. Can affect almost all the organs.
Brain numbness.
Stroke, like you mentioned, is a risk factor for having stroke and all that. So yes. So I mean, we are almost coming to the end. Please calculate the scores and let me see who wins the diabetic round. And I'll have the last words from my contestants, and then I'll declare the winner. So Suarez,
Yes, sir.
give me your last words.
My last words is 3 people have died from diabetes. So I'm well informed of diabetes. Have many branches, but today we've learned about 2. That is type 1 and type 2. We even have there's even gestation diabetes.
Gestational diabetes.
Don't go with Type 1 is the people who do not have insulin at all or very, very small.
Okay.
That cannot do too much because insulin in the blood or the bloodstream will take sugar out of the blood into the cell so that it will give you energy. So if you don't have the insulin taking sugar into the cell
To give
you energy, you become tired. Now you have to eat a lot because the body is thinking that why am I not having energy? Maybe I have not eaten. Come on, go ahead. Then you eat. I say, it's not. Then you eat. Then the sugar too is going into the blood. Nobody is putting it in the cells.
Okay.
Then you will be there. Then your body, something will tell the liver that liver. What can you say? No.
Kidney.
Ask kidney. Then kidney say, me. Since I have not sold one, my brother, then the 2 of us we can let you urinate. Telling you to urinate. Then
The water is going up.
it's going to dehydrate. And you say that let me drink. So we'll be urinating more, we'll be drinking more and chopping more and tired.
More. And if you chop too much, you worry the body.
Yes, because the more sugar they come. So that is what I've learned.
So what have you also learned? How can you help yourself to prevent the diabetes?
So I know diabetes cannot be cured.
Okay.
It can be managed efficiently, right?
Yeah.
Okay. Now, if you want chop, let's say the plate be round. If you divide the plate into half, the top, you go divide the top into half. Carbo for the one corner, small, then put into the corner, but the top, the half for the down, all the
Vegetable.
vegetable.
And your medications to
So
make,
regular. If they say one in the morning, one in the evening, do one.
yeah.
Go prepare. So say the sugar level will come down, give you.
Okay. How about exercising?
It is rough. You know, exercise. This cross exercise will make the cells
The cells sensitive to the insulin.
Yes. It's because you didn't shake up. You get like that.
So if you don't do all these things, what are some of the complications?
Oh, well, you dey know your eye dey go up. You start to do like partial ground. You see, you feel like
Okay. 1.
if you no take time, you fit get stroke.
Okay.
If you dey something catch you, say no something catch you. Because if it catch you, you know they
You no go feel am.
That place die.
Yes.
Then if you no take time to that thing no go die. As catch you like no go die, you go see no pack. Then catch you.
Yes. Eventually, can even die out of this world.
Easy.
Charlie, you guys, you've tried.
Thank you.
So at the end of the diabetic round, Kamasa has
21 points.
and then Suarez has 25.5
points.
The spirits of the 3 people who died are behind me.
So tomorrow we'll meet here and then we'll see who will win the hypertension round.
Okay.
All right, guys.
Thank you.
I'm
very
done.
much.